So have you been managing your swelling or your lymphedema well, and then all of a sudden you feel like you went backwards and had a flare up or worsening in your swelling? Getting the swelling back down can be really frustrating and not as simple as just putting on your compression stockings or garments and moving on. My name is Kelly, and over the last decade as a certified lymphedema therapist, I have seen a variety of successful ways to do this, some which I have learned from individuals that I have treated. So whether you're dealing with a mild flare-up or more severe cases, there's something here for you as we talk about a few ways to help reduce swelling after a flare-up. So one effective approach in the management of lymphedema involves traditional use of short stretch bandaging with various foams and paddings. This is the traditional way used to reduce swelling and lymphedema that many of you have had in therapy. And if someone has had a flare-up, going back and doing a short course of bandaging for even just a few days or weeks can help get the fluid back down quickly before moving back into your compression garments. Short stretch bandages applied should still be applied over foams or paddings to distribute that pressure evenly and prevent discomfort while, again, enhancing that effective compression therapy to really reduce the limb size. This standard and traditional method is really beneficial for someone who has more moderate to severe lymphedema, as it helps to reshape that tissue, soften that fibrosis, and really improve the limb contour or shape over time. Now, if someone does not have foams or paddings, or they do instead have a nighttime compression garment or even a compression liner like this one from Solaris, these can be really helpful to help reduce the flare-ups, especially if they are more mild. So nighttime compression garments are specifically designed to be worn during sleep, but wearing them longer times during the evenings or even maybe during the day can be really helpful because of that increased compression and some of that thickened foam to help soften fibrosis, and also can help reduce that fluid. One small trick that has worked for some, and if cleared for safety by their medical team, is to wear their compression or nighttime garment and then bandage over the top of that, just like you would with a liner. It's the similar thought of using foams and paddings, but these nighttime garments tend to be a little bit thicker and they can be more comfortable to bandage over the top of. It also can be easier to use in some of the foams and paddings, and someone who has that, it makes it just a shorter process and doesn't take as much time in the evenings to get on and off. So if someone's using their nighttime garment and bandaging, this can be done just for a short period of time. Sometimes even one night or 2 nights can make a really big difference. Now, things like pneumatic compression pumps or doing lymphatic drainage may be helpful for tune-ups too, but let's talk about a unique option, the Circaid Reduction Kit. The Circaid Reduction Kit is not a traditional Velcro wrap, although it looks just like one. The Circaid Reduction Kits are advanced kits that are custom fitted. So as you can see, there's Velcro lining. They are trimmed and cut and shaped for someone and what their size is. They're used as an alternative to compression bandaging to help with that reduction phase, or that first part of complete decongestive therapy, to help reduce someone's swelling. And as someone reduces down, the sizing and the Velcro are continuously adjusted for progression. So as someone gets smaller, they may take this Velcro and move it over to make the garment smaller, again, adjusting as someone reduces in size. Once someone is down in volume or the amount of swelling they're trying to get rid of, this can then be used ongoing for management, just like maintenance garments or other Velcro wraps. These reduction kits come in about all areas of the body, not just for legs. They have ones for arms, they have ones for the body, they even have ones for the head and neck area. The reduction kit may be a good fit for some who don't do well with compression garments and also who have just more difficulty with that self-bandaging. I will place links for this for more information in the description box down below that someone can check out. So whether utilizing short stretch bandaging with different foams and paddings, using your nighttime garments with your compression, or using a Circaid Reduction Kit, individuals with lymphedema have options to alleviate flare-ups and get back on track with less pain and more mobility. I hope this information was helpful, and if you have found an option that has worked well for you, please comment that down below to share with others. Hope you all found this video helpful, and we'll see you all in the next video. Thanks, everyone.